in many things in life, you're right. You just kind of stuck. And if you're so busy and you're just trying to kind of keep your head above the water, you don't have time to look around and try and figure out that there might be a boat floating by, right? That you can hop on. And so you just are just trying to stay alive. And I think a lot of physicians are like that. If you don't see it in your training, either as a medical student or as a resident, and you don't, there aren't advertisements for direct primary care on TV, or the solutions for exiting are just not obvious. And I think that's one of the biggest problems. And I think there's maybe on some level, there's a little bit less entrepreneurial sort of spirit within medicine. And I think if that's a generational thing, I'm not quite sure, but I think there are a lot of people who are content with just taking a job and being employed without recognizing that they don't have to. And then also that it comes with a cost, and the cost is your autonomy and your ability to sort of, to control things in your life. I think there's definitely a temptation to think, well, I've got a safe salary or whatever, not realizing what you're trading for that, because the risk is necessary on some level to sometimes get what you really want, and to have the relationship that you want with your patients, which is, I think, what draws us into medicine. It's what keeps you happy in medicine. If you lose that, which you see that a lot of times these primary care docs, and actually really all physicians, it's not just primary care, but if you lose that relationship or the ability to form relationships that you like, that's really what I think drives the burnout and really the frustration in medicine.